Good afternoon and welcome to The Problem with Being Awake. My name's Ben and I'll be your host. And the transgender issue is going to be a big part of the US election, more than people think. People wrongly in the left-wing media assume that it doesn't bother most Americans, but it bothers almost every father. It bothers every conservative. It bothers a lot of Democrats that this new trans wave has come in and swept up so much of the public eye and society and change, and is constantly knocking on the door for more than equal rights. The idea that the world female boxing Olympic champion is a man should make us all concerned. But there are huge concerns within the American populace, because when you meet working class men, policemen, firemen, the people who run all the jobs that we need that don't get the thanks they need or they deserve, and you run it up against pretty much anyone who's not a leftist liberal, and they say no thank you, don't give puberty blockers to my children that sterilize them and don't give them cross-sex hormones, and don't chop off anything from their body or add anything to their body. They're children. Now, here's how it happened, and here's who propagated it. Gender dysphoria used to be a mental health disorder until it was declassified in 2019 by the World Health Organization. And it's got lots of NGOs, they're all corrupt, and they started the transgender craze. It was already getting some heat because a European thing did declassify it in 2013, but officially it was still a mental health disorder in 2019, affecting 0.004% of the people in the country or in the world. It's a rare disorder, and having a mental health disorder is not a problem. I have PTSD from 20 years old. I manage it. It doesn't affect my day, but I just have to recognise it's there. Occasionally it can come back to me, but very rare. I manage it well. Doesn't cause my life any problems. But if you look 2019 to now 2024, well, the Olympics was pretty much the trans Olympics. The idea that even people are debating issues like whether men should just be able to randomly walk into girls' bathrooms and changing rooms is sickening. It really is. And the fact they're debating whether they should be allowed to compete in sports is absolutely ridiculous. Serena Williams, if a male tennis player ranked number 300 in the world transitioned but didn't actually have a sex change, just said they became a she, and they wanted to play in women's tennis, they would be the number one seed in the world because of the speed of their serve and the absolute inability for a woman to keep up with that speed because of the difference in height, bone density, and strength. So we debate these issues in society. Here's who propagated it badly, and it's called WPATH, the World Professional Association of Transgender Health. There are leaked files by Michael Schoenberger on environmentalsuccess.org. It's 120 pages and one video, and if you watch that video, you all want that organisation to be shut down immediately, and they should have been, but they weren't. It shows one thing, one of the 12 directors of WPATH, the World Professional Association of Transgender Health, fabricated a lot of his qualifications and actually has a fetish for cutting off young prepubescent boys' testicles. That should not be allowed to be practiced, but WPATH made it so he could. A lot of their directors have lied about their credentials and lied about the research that dates back 35 years. The scandal that they've advised in terms of how to approach this, and advice given specifically to parents and people needing the treatment or wanting the treatment, is that if the parent doesn't agree to the treatment, the child's likely to kill themselves, which is a fabrication of the truth. And they know full well that trans suicidality is at its peak 2 years after successful surgery and not before it. And there is no evidence to support, if you deny the child gender-affirming care, there's no evidence to support that really increases anyone's risk of suicide. Because the Haas report from the UK showed how dangerous and experimental this medicine is. It's successful only once in every 2 attempts. Trans surgery is successful 50% of the time. The minimum we accept in England for a medical necessity is 1 in 14 failure rate, and they have a 1 in 2 failure rate, which means it needs to be redone. They don't tell children, unless they ask. If they ask, they tell them. If they don't ask, they don't tell them the puberty blockers will not only stop their puberty, which is the only way any person can make a reasonable decision about themselves and how they feel about, if they are trans. Because before it was made legal to be for prepubescent children, 85%, over 40 years, 85% of people consistently chose the same body and entered into same-sex relationships. And the other 15% were well informed, had been through the therapy, knew the procedure, knew all of the risks and side effects. They didn't have the risk of becoming infertile because the puberty blockers were not prescribed for that sort of thing. They were there for a very rare disease where people start puberty in their young years, like 6, 7, 8, and you give it to them for a couple of years to stop that, and then normal puberty kicks in. That's the only reason, and also to sterilise rapists in prison. So you don't want your young one getting given a drug they use to sterilise rapists, really. But they don't tell you that unless you are, and they also don't tell you you'll never really experience sexual pleasure. Now, the fact that they're still around and still haven't crumbled is a testament to the corruption of the left in America, the corruption of the Democrat Party, and the absolute dereliction of duty and care, and what happened to do no harm. There is extensive evidence of long-term negative effects, such as 2 different types of cancer and 4 or 5 other killing conditions and many debilitating conditions. There's no way you can go through that treatment and come out perfect if you're a kid. As an adult, it is different. And in England now, you have to be an adult, but now we have a black market for the puberty blockers, and there's one in America where it has to be banned state by state. And if Kamala Harris gets in, it will not be banned. Minnesota has the most liberal trans laws of any area in the world, so much so that if a parent doesn't immediately agree to their child's desire to change sex, that is now, Tim Wolf's purposely moved that into the category of child abuse. So this is getting mad. People are being taken away from their parents so they can have trans surgery, and then so many of them regret it later, which is why there are so many detransitioners like Chloe Cole. Look her up and listen to her story, and then you will understand. I'll leave it there, but the world needs to make a common sense solution on this, and it can't be to carry on with this trans mania, because it's not 0.004% cannot jump to 1% even by any scientific psychological matter. It has to be social. So I'll leave it there. You be lucky, I'll be good, and I'll see you soon.